Welcome back to this 6-part series about eating disorders in kids. Today we are going to look at some myths and compare those against some facts. We're going to understand what causes eating disorders in children and how and why they develop. To start with, let's consider our own biases with regards to eating disorders. Is what we know fact or fiction? How can we avoid adding to the stigma around these conditions? What are their causes and what are their risk factors? Firstly, there is no one cause of an eating disorder. As we've alluded to in part 1, these are complex, multifaceted disorders. While simplifying things is a natural human trait, we need to move away from prejudicial beliefs such as it was this person's fault or it was this particular cause. We need to get away from the idea of one cause or one triggering event. Importantly, it is never the fault of the young person, their family, or anyone else for that matter. We will come back to this point shortly. Whilst there is not one single cause, there are many recognized risk factors. These include biological, psychological, and socio-cultural factors that combine and interact in a way that is different for each and every person. A few of these include having low self-esteem, experiencing mental health difficulties such as anxiety and depression, having perfectionist traits or high standards and expectations, identifying as part of the LGBTQ society, dieting, having a close relative with an eating disorder, having type 1 diabetes, or being dissatisfied with your own body image. Importantly, whilst these factors increase risk, experiencing one or more of these does not necessarily lead to somebody developing an eating disorder. Instead, it simply means they are at a higher risk of doing so. In most cases, there are not easy or obvious early warning signs to identify. These are conditions that can creep up on young people and their families without warning. They can also be misleading to health professionals and present with vague physical complaints. Furthermore, shame and guilt often prevents disclosures of difficulty. Indeed, the conditions are characterized by a lack of insight or understanding, and so this too can prevent people asking for help. Once certain factors combine with certain circumstances, a tipping point is reached. Families often blame themselves in retrospect, thinking that they could have prevented things from happening. However, in reality, this is rarely the case. Eating disorders are incredibly difficult to prevent. I'm going to use an avalanche analogy borrowed from colleagues at HAMPSHIRE CAMHS. People are like mountains. They may be steep or they may be shallow, and snow are the risk factors that can accumulate upon them. Some young people accumulate a great deal of risk factors, but are never triggered into an avalanche, into an eating disorder, whilst other people only accumulate a few risk factors, and that's enough to set it off. Each and every person is different. An eating disorder requires just the right combination of conditions for the problem to begin. And much like an avalanche, when an eating disorder starts, it is incredibly difficult to stop it. For many people, this tipping point arrives and there is no turning around. The situation changes and becomes an eating disorder. Help is needed and action warranted. A further helpful analogy, again borrowed from colleagues in Hampshire CAMHS, is that of a puppy that has become dangerous. Often, the resulting dangerous thoughts and behaviours of an eating disorder have their root in noble, healthy goals and ideas. There may have previously been a desire to be healthy, to look after yourself, to control your body, to control your future, or perhaps to have looked a certain way. All of these are desirable, much like a new puppy. Unfortunately, it is possible that these desires, thoughts and behaviours become twisted and become dangerous and therefore pathological and no longer healthy. It is as if that cute puppy from the start has now become a dangerous dog. Another challenging element for children and families with eating disorders is how everybody seems to have an opinion. Think about your own opinions, right or wrong, that you may or may not have about eating disorders. Examples include: eating disorders are just an extreme end of normal. They're a phase, a fad. They'll pass with time. It'll be okay if we do nothing. It'll sort itself out. The person just needs to try a little bit harder and they'll get better. Regretfully, these sorts of thoughts can cost precious time and delay treatment. All the while, irreversible harm is occurring both physically and psychologically, with long-term ill health and even death at stake if care is not instigated by people who understand what they're doing. As health professionals, we can contribute knowledge of what is likely to help and less likely to help. However, we all need to inform ourselves of the facts and avoid the myths. Our role and our goals include having a low index of suspicion for diagnosis and then finding the correct pathway to start treatment and reduce the damage caused by this range of destructive diseases. Be wary of uninformed opinions, help that isn't helpful, and of course, avoid outright harmful advice. Treatment requires highly skilled oversight from specialist professionals at the earliest opportunity. Another element that defines eating disorders is how they are a disease of both the brain and the body, not one or the other. Consider how, when a person is starved, they begin to behave in ways that is very reminiscent of a person with an eating disorder. When someone starves, their metabolism changes. They begin to develop physical sensations like pain, palpitations, dizziness, and nausea. Their thinking and thoughts become distorted. The body and brain are intertwined. It is impossible to separate them, and we shouldn't try to. It can be difficult for teams to understand this, but it is important that teams that can care for the physical and psychological are both involved together holistically and have shared goals. So, how do we know what is normal and what is not normal? How do we tell apart signs of an eating disorder from normal adolescent behaviour? Of course, a person's behaviour has many influences: their personality, their friends, their genetics, their family, their circumstances, school, mood, physical health, much more besides. And As a result, it can be difficult to determine whether perhaps a change in behaviour or challenging behaviour is a sign of them in distress as a teenager, perhaps they're frustrated or bored, or whether in fact it is the result of their disease, an eating disorder in its early stages. It is often a case of determining if the person is coming to harm. Are the behaviours resulting in altered eating or starting to show clues that psychological or physical harm is occurring? Let's listen again to the perspective of our young expert.
Personally, in my experience, my eating disorder definitely, I think, did serve some purposes. When the year in which my eating disorder began to develop, which was when I was around 14, 13, 14, there was a lot going on in my life at the time, a lot of really difficult and tricky things that for anyone would be really, really difficult. And it definitely kind of evolved as a coping strategy. I would say it made me feel safe. It made me feel something that I could kind of use, not a healthy way of using it, granted, but it did make me feel more safe, and it did help me decrease that anxiety towards the other things I was feeling. My eating disorder was also very much tied into my body image. For me, at least, I think there's this big image of when you hear eating disorder and anorexia especially, that there's this desire to be thin, to be pretty, to look like a model. And for some people that is the case, and for some people that is a thought that does promote or encourage an eating disorder to develop. But in my case, that wasn't a thought that was actually involved in my eating disorder at all. For me, being thin and the desire to lose weight was always very much a safe thing for me. I got quite a lot of unwanted sexual attention growing up, which made puberty and my changing body a really uncomfortable experience for me. So losing weight and using food to control how I looked was very comforting to me. It made me feel a lot more safe, because I felt that if I looked a certain way, then people wouldn't take any notice of me. They wouldn't want to hurt me, for instance. So I guess in that regard, my eating disorder was kind of like a security and kind of protective thing. It's something I used to look after myself, which I know now really isn't healthy and is not at all what you should do, but kind of that's how it evolved.
Next time, in part 3, we will be looking at how these conditions present, how do they start, and what impact do they have on young people's lives and people in their family. Thank you.